acenitobacter baumanni outlines of discussion that basic microbiological features of the acenitobacter baumanni and spectrums of the clinical manifestations and resistance mechanisms, treatment options, carbamazepine resistance acenitobacter baumanni. Let's discuss that specifically. So acenitobacter baumanni, it is an aerobic catalase positive, oxidase negative, glucose non-fermenting, non-motile, and non-fastidious gram negative Coccobacillus. It is the most virulent species, and acenitobacter pt, acenitobacter nosocomialis, acenitobacter lawfully is it is a virulent bacteria. So it is naturally enhanced water, naturally inhabited, which is found in water, soil, and other possible reservoirs, including the arthropod and the food animals. So it is characterized by its resistance to the harsh environment factors, and it can colonize skin, wound, and the respiratory and GI tract ones. So acenitobacter baumanni, in totality, how it transmit person to person. It shows that diagrammatically health care workers, from health care worker, it can transfer to the patient, from the patient health care workers hand, or large droplets from the mouth and nose, and respiratory suction, a wound, then it is to the patient, or it comes back to the physician, then acenitobacter shed patient. It is a vicious circle. It can be transferred to one to the other persons. So what are the risk factors for acenitobacter baumanni is ICU admission, long-term care facility, recent surgery, and the central vascular catheterizations, trachea, and mechanical ventilation, the enterals feeding and treatments with their generations of cephalosporin, fluoroquinolone, and carbapenem resistance. So war and nature disorders is what this is the risk factor what I list out. So Raquibacters, the name of Raquibacters, which is found in Iraq soldiers in Afghanistan, is Raquibacter. So the WHO declared that the acenitobacter baumanni is one of the escape bacteria organisms, that is Enterococcus, Staphylococcus, Klebsiella, acenitobacter baumanni, Pseudomonas, and Enterococcus. This is abbreviation escapes. So the virulence factors here for outer membrane proteins, the phospholipids, the proteins, lipopolysaccharides, capsules, polysaccharides, proteins, and the secretions and others. So the resistance mechanisms for acenitobacter baumanni is enzymatic degradation, largest modifications, and the multiple drug reflux. There is acenitobacter infection had the highest risk for the mortality has compared to the MRSA and multi-drug resistant gram-negative bacteria. So it can cause infection in almost any organisms, in any organ. It can be in a hen, it can be in a cat, it can be in a dog, it can be a donkey, it can be a human being as well. So ventilator-associated pneumonia is the most frequently healthy care-associated acenitobacter baumanni, and the blood streams associated with the intravenous access, the surgical site infections, the urinary tract infection managed after new surgery and surgical tract infection. Commonly acquired infection has been characterized by the pharyngeal carriage of the organisms and aggressive lumina, the pneumonia and high case fatality rate. So risk factor for including that the tobacco is for adult tobacco, the COPD and diabetes and so on. This is for adult, not the pediatrics. So the community acquired acenitobacter baumanni, so fulminant illness with the abrupt onsets of the lipid and the productions to respiratory failures and the hemodynamic instability. So bloodstreams infection, infecting endocarditis and meningitis, surgical site infection and urinary tract infection is common. So now in general there is mechanisms, the resistance mechanisms for this acenitobacter baumanni. When we see that the first mechanisms, there is mechanisms of beta-lactam inhibition, the ABCD. It's four mechanisms that the modifications of the protein binding proteins, the efflux mechanism, the degradations of beta-lactamase, and the modifications of the outer membrane protein. So the other mechanism resistance to aminoglycosides. The aminoglycosides that there is three mechanisms that degradation of the amyl at hydroxyl and amide groups and efflux mechanism, modifications of ribosomal encoding proteins. And the third mechanisms of the resistance is that the respiratory mechanisms of the resistance mechanisms of the phenylketonuria, which is that the efflux pump mutations of the DNA genes. In the others, the fourth one is resistance to the mechanisms of the collision and loss of the lipid, the LPS, which is lipopolysaccharides. So these are that we expect. So resistance mechanisms, MPC, antimicrobial protein C, beta-lactamase are chromosomically encoded in cephalosporin intrinsic to the acenitobacter baumanni. So MPC is not induced in the acenitobacter baumanni, is it? So fluoroquinolones resistance through the mechanisms of the genetic gyres A and PAR-C proteins. So aminoglycoside resistance. What I'm saying this that early. So there is three type of resistance mechanisms. One, there is the multi-drug resistance, XDR resistance, pan-drug resistance. So multi-drug resistance, non-susceptible to greater than one agent in 3 antimicrobial category. Take three category. For example, penicillins, cephalosporins, aminoglycosides, carbapenem, monopenem. From this, if there is 3 out of 3 category greater than 1, susceptibility to non-susceptible greater than 1 agent in 3 category. 3 category 1 and more. So if you get is MDR, if you get from penicillin, for example, from cephalosporin, there is cefepime or ceftazidime, and from aminoglycosides, there is gentamicin, amikacin 2, and from others, the fluoroquinolone, if there is Cipro, yes, this is MDX, because it has non-susceptible greater than 1 non-susceptible per 3 category greater than 1 3. So XDR ደግሞ non-susceptible greater than 1 in all but less than 2 categories ገብቷል። ግን ይሄ ነገር አልገባኝም እኔ ራሱ ለምን non-susceptible greater than one agent is non-susceptible, but in all bats less than 2 categories, greater than 3 antimicrobial category. In all. Okay, good. ፓን ድራግ ነን ከሆነ ፓን። ሶ acinetobacter is diagnosed from PCR or MALT-D top. ለምን ከዛ ላይ ይሆናል። ሶ drugs susceptibility broad spectrum cephalosporin, beta lactamase, LS or carbapenem and the beta lactamase inhibitor. So the drug resistance, how to manage that? The drug susceptibility is a broad spectrum cephalosporin, beta lactamase inhibitor or carbapenem. The beta lactamase inhibitor sulbactam has excellent bactericidal activity and against acinetobacter isolation. So the other drug resistance strains, it is difficult to treat, and drug resistance difficult. So cephalosporin is common treatments on that. If it is available, cephalosporin is good. Yes, and the other thing what we consider is that what we consider here. What you consider here is that carbamazepine resistance to specimen or wounds from resistance, not always clear where it is colonized or through pathogens or OX2440 like carbamazepine or ስለዚህ እነዚህ ሜታሎ ቤታ የሚባሉት አሉ። ሶ ሬዚስታንስ ኮምቢኔሽን ሶ ኮሊስቲን ሪፋምፒሲን ኮሊስቲን ፎስፎማይሲን ኮሊስቲን ሜሮፔንም ኮሊስቲን አምሲሊን ሰርባክታም ኮሊስቲን cephalosporin. It is the only novel FDA approved beta lactam agonist within the vitro activity against the carbamazepine resistance. Acinetobacter pioneer accelerated that cephalosporin is very important drugs, you know. The others that ampicillin sulbactam plus carbapenem, ampicillin sulbactam, carbapenem combinations therapy is also effective for the treatments of MDR, acinetobacter, baumanni and bacterium and why not ampicillin sulbactam plus የምሰጥ ይቆይድናል ግን የለን it is the skin and the soft tissue infections of the carbamazepines and resistance to the acinetobacter baumanni, you know. Okay, here why if it is carbapenem resistance acinetobacter baumanni, what is there is 3 options. 1, it is severe, less severe, pan. If it is severe, for example, hospital acquired infection, ventilator associated, no healthcare associated infection, the ventilator associated infection, bloodstream infection, or severe sepsis or with shock, what you do? 2 vitro activity. If it is susceptible, give that treatment with the combinations of the 2 vitro agent. 2 vitro activity against not susceptible, what in vitro synergy test for the choice of the combinations of the ሸም ይሰጣል። አሁን ምን ታደርጋለህ? ሲነርጂ ቴስት ይሰራል። ሴንሲቲቪቲ እንደ ካልቸር ይሰራል ማለት ነው። then you can give in vitro if it is yes, otherwise if it is sensitively otherwise ግን in vitro susceptibility test that combinations of ሸም ይሰራ ይችላል። the others if less severe ከሆነ ምን አለ? less severe ከሆነ ዋት ግን ካርባፔነም ሬዚስታንስ ሆኗል ለሲቨር። ስለዚህ ሃይዶዝ አምፒሲሊን ሳልባክታም መስጠት ትችላለህ እኮ። አምፒሲሊን ሳልባክታም ካለን ፖሊሚክሲን መስጠት እንችላለን። ተጋሳይክሊንስ፣ ሚኖሳይክሊን፣ ተጋሳይክሊን፣ ሚኖሳይክሊን ሃይ ዶዝ ሊሰጥ ይችላል። ኤንዛዛ አምሲሊን ሳልባክታም ሲሰጥ ይችላል። ላይክ ዩሪናሪ ትራክት ኢንፌክሽን ከሆነ ዚስ ፔሸንት ሃዝ ኢንትራ አብዶሚናል ነው ያላት ትሪትመንት። ስለዚህ ተሳስቼ ነበር ማለት ነው። ስለዚህ ብሬድ ስትሪም ከሆነ አሁን መጀመሪያ ሲቪር ከሆነ ምንድን ነው ቱ ኤጀንት ያለ ኢንቪትሮ አክቲቪቲ ኢፍ ኢት ኢዝ ኦኬ ጊቭ ዛት አዘርዋይዝ ኖት ከሆነ ደግሞ ቪትሮ ሲነርጂ ይሰራል። ኢፍ ኢት ኢዝ ሰሴፕተብል ከሆነ ጊቭ ዛት አዘርስ ለስ ከሆነ ለምሳሌ ብሬድ ስትሪም ሰርጂካል ሳይት ኢንፌክሽን ይህ ሰርጂካል ሳይት ኢንፌክሽን ነው ኮንሲደር ያደረግነው ማለት። ስለዚህ ምን ሰጥ ይችላል ሃይዶዝ አምፒሊን ሳልባክታም ሰጥ ቆይድናል ለዩሪናሪ ትራክት ዘሴም ሺት ግን ካልሆነ ሴፍ ያደርጉ አቬለብል ኢፍ አቬለብል ኦር ትሪፕል ድራግስ ኮምቢኔሽንስ ኦፍ ዘ ኮሊስቲን ሃይ ዶዝ ሚሮፔነም ኤንድ ሃይ ዶዝ አሚሲሊን ሳልባክታም ስሪ ድራግስ ኦር ሴፍ ያደርጉ። ይሄ ኢንጀነራል ነው። ኦኬ ታንክ ዩ ሃቭ ኤ ናይስ ታይም።